Just a few reminders. Like I said, we are doing 4 live webinars for primary care physicians and office staff, 4 live webinars for primary care offices on best practices for practice management. And we will have 2 new recorded webinars for primary care office staff. And we will also have some new parenting and mealtime and playtime handouts. All of these resources will help with our mission of nutrition and activity advice, but also some counseling and advice during COVID-19. We also have—
Alex, sorry to interrupt you. We haven't advanced past the intro slide. We can't see anything else.
Oh, there we go. Can you see now?
And I don't think they were able to see the numbers from before for the text.
I'm so sorry about that. Let's go back. So here are the numbers and what you text for the word cloud. Sorry about my technical difficulties. So you can get that set up for the word cloud. And then this is the updates. Our next training in this series will be next Thursday, January 21st at 12 p.m. And it will be on how to use social media to engage families. And Dr. Nicole Bodwin will be presenting on this topic. So we're very excited about that training. If you're interested in registering for our PMP toolkit, which has online modules and lots of important information about nutrition and activity advice and a lot of great content, you can register for that in this link there. And then we also have a PMP journal club that will be for MOC and CME credit. There'll be 20 points available and you can access that link there as well. Some of our PMP resources, we have handouts that are available on the Ohio AP website, as well as the mobile application that you can download on Google Play or the App Store. And these are both great resources with handouts to share with your families. Some Zoom tips: please make sure that your lines are muted. You can ask questions and make comments in the chat box throughout the training. I will be monitoring that, so I will answer those promptly. Dr. Walker and Dr. Garbaz will answer questions throughout the training, and then we will also take questions at the end. Please don't share your video because the presenters will be sharing their video. And if you have trouble hearing or seeing the presentation, please let me know in the chat box. These speakers have nothing to disclose and no off-label products will be discussed. And now I will let them introduce themselves, and then Dr. Walker will start with the presentation.
Hi, everybody. I'm Dr. Lauren Garbaz, a psychologist at Nationwide Children's Hospital. I currently work in a feeding program, and I'm really excited to be here to talk with you all today.
Hi, I'm Dr. Walker. I'm a psychologist also at Nationwide Children's Hospital. I currently work in pediatric primary care over at the Hilltop Primary Care Center for Nationwide Children's. So I'm going to start sharing my screen now. Okay, hopefully everybody can see. So first, before I get started talking, I actually just want to take a moment of silence for the loved ones that we've lost, the colleagues that we've lost to COVID-19, and also the tireless efforts of our healthcare workers. Thank you. Okay, and so to start us off today, I want to do an imaginal exercise. So imagine yourself running, hiking, or biking, whatever you prefer, a new route. You find yourself at the bottom of a long, steep hill, and you know it's steep as you're going up. You can feel the extra strain on your knees and your heart, and you really think about stopping, but it looks like the hill is going to level off up ahead, so you keep going. Then the path levels off, but just as you start to catch your breath and feel like the hard part is over, the path turns and there's another hill up ahead of you. So what emotion washes over you in that moment? Is it frustration? Is it exasperation, panic, defeat? How many times have we faced these and other difficult emotions during this pandemic? So what in this pandemic, what have these hills, these stressors actually been in our clinic setting? So we're going to look at some research that's been done over recent months examining those stressors. And then what about that extra strain on the knees and the heart as you climb the hill? We're going to also look at studies, what those same studies have to say about the impact of the stressors on our bodies and minds. And then how can we cope with these unexpected hills, especially when nobody knows when the pandemic will be over? Dr. Garbaz will discuss stress management, adaptations in mental health care, and discuss vaccination challenges. And then finally, still on your run, or your hike or bike, no end in sight, the hill level's off again, and you take a look all the way down, and you see for the first time how high you've climbed, how far you've come, and you feel a wave of pride as you come to terms with what you've accomplished. You feel inspired as you realize what this means for you, how capable and strong you are, and that nobody can take that away from you, how you've gotten yourself this far, no matter what. We'll wrap up today by exploring applications from the post-traumatic growth literature and strategies for building resilience. And just before I move on, if you could just shout out or put in the chat box if there's anything else that you're hoping we would discuss today, and we might be able to pivot or adjust to include anything else you are wanting us to discuss. Okay. So I actually want to take a look back with that in mind, and I'm going to start with a local news update. So I'm going to try to share a different screen here. See how this works.
Now, breaking news from NBC4.
Am I sharing my video screen? Because I don't think I am.
We just see a black screen.
Okay. Let me pause my sharing and then do, there, that worked better. Okay. Can you see it now?
Yes.
You seeing a video? Okay.
Mm-hmm.
So this is a local news update from March 9th. So right at the beginning, or what we thought was the beginning of the pandemic.
Now, breaking news from NBC4.
We begin this Monday with breaking news. First at 4, 3 people have now tested positive for the coronavirus right here in Ohio. Thank you, everybody, for joining us. First at 4, I'm Darlene Hill.
And I'm Brad Johansson. This was announced by Governor Mike DeWine at a news conference within the last hour. The governor also has now declared a state of emergency. And NBC4, the first to break that news in a push alert and on Twitter.
NBC4's Jason Aubrey was at that news conference a short time ago. He joins us now with more on what he has learned. Jason.
Darlene, we know that the 3 people who have tested positive for coronavirus here in Ohio are all from the Cuyahoga County area. All 3 of them testing positive today, coming back with that positive test. We know that 2 of those individuals are a married couple. They were on a cruise on the Nile recently. They've come home, tested positive now. One of them has been hospitalized, the other one not yet. The 3rd individual, unrelated to the previous 2, tested positive after attending a conference in Washington, D.C. And all 3 of them are in their mid-50s. Tonight, the governor and the director of the Department of Health here in Ohio are recommending older adults avoid crowds. They say that is the older that you are, the more likely you are going to potentially get this virus. Now, what we do know is that they have activated the Emergency Operations Center. That happened at 1 o'clock this afternoon, and that the hotline that we told you about last week is still up and running. They told us that that over 1,000 people have made calls this weekend to that hotline, and that if you feel like you should continue to use that hotline. And the medical professionals, the professionals who are answering those calls, will assist you any way they can. For now, if you have concerns about whether or not you may have been exposed to these individuals, the health department tells us they will contact you. Take a listen.
If anyone came into contact with the individuals, they will be notified. So please know that you will be notified if you came into contact with the cases.
Now, the state government is telling everyone we need to use common sense now. They also announced that there would be a halt to all travel for state employees that was non-essential. Life is going to be different, they tell us, here in Ohio over the next few weeks to months until this epidemic can be resolved. They ask for patience, and they tell us that they will continue to provide information as soon as they know it, when they have it in their hands as well. For now, we are live down here at the State House. Local for you, I'm Jason Aubrey, NBC4.
All right.
Okay. So for me, watching that is pretty surreal. There we go. Everybody seeing the presentation again?
Yes, we can see
Yes.
it.
Okay. Hearing things like older adults should avoid crowds, life is going to be different for the next weeks to months, and we're coming up on a year. Even looking, these pictures here are from COVID updates from Governor DeWine. Seeing the first one, which is from early or mid-March. Nobody's wearing a mask. They're kind of sort of practicing social distancing, but not really. Into a more recent one where obviously he's presenting solo. So I think these things just help me kind of appreciate the magnitude of the pandemic. And now I want to get into 3 studies that have been done all in the US. The first one is the Places Study, Pediatrician Life and Career Experience Study. That's an AAP cohort study that tracks the career and life choices of pediatricians across their careers. And in this report, participants were 730 early and mid-career pediatricians in primary care practice, and these data were collected in April. The second study, the Mental Health America study, those data were collected from June to September from just over 1,000 healthcare workers. So that's the most general study. And then the Berksey study was conducted most recently. It was done in October, a smaller study of just 500 healthcare workers, and that one excluded physicians. And so going back to the early pandemic stressors, this again was done in April. So already in April, these data showed the rapid shift from in-person care to telehealth, a shift from 85% of pediatricians' offices never using telehealth to 77% often using telehealth already by April. And just again, thinking about really, the magnitude of what that was like to implement that. That involved efforts and workflow changes for virtually all clinic staff, not just pediatricians, so including administrators, IT, registration staff, interpreters, and then people like me and Dr. Garbaz, social workers, psychologists as well. And then another early, pretty drastic shift in pediatric primary care was reduction in visits. By April already, vast majority of pediatricians, 71%, experienced a decrease in preventive visits in their practice greater than 50%. And then that was even greater for sick visits, with 83% experiencing a decrease in sick visits of greater than 50%. That decrease in patient volumes then was felt financially by many healthcare workers and clinics. And so this news article just discusses the fact that many doctors' offices were forced to close Not every clinic had the kind of financial safety net to survive that level of decreased revenue. And then this is a quote from the Places study from a primary care pediatrician in a small practice and a mother of 2 children. She said, patient visits fell dramatically. My money flow stopped. My income was greatly impacted and continues to be now because my own children are not in school full-time and I cannot work full-time as a result. And so that quote highlights the interaction between workplace and personal stressors during the, for healthcare workers during the pandemic. And so the Mental Health America study asked healthcare workers, what are your top 3 personal or home related stressors over the last 3 months? Right up there at the top, over 60% said they're too tired when they get home to cook, to do chores. Loneliness, that makes sense given obviously social distancing in our personal lives, but even at work, with social distancing, there's less socialization happening oftentimes. And then we see financial stress, as we just discussed in the previous slide. In the quote also, she mentioned kind of what that unplanned PTO, the impact of that when you have to be home for childcare, or if you're waiting for your COVID results to come in. All that unplanned PTO is another stressor that they didn't ask about in this study, but I think could probably be up there. Another one they didn't ask about, but I think should probably be up there is decreased restorative activities. Those things we do to relax, to rejuvenate, canceled travel during the pandemic and vacations, less opportunity for, group physical activities or other social connections that definitely has an impact on how we're feeling. And then another thing just to point out on this table, homeschooling. So at the bottom, you see they kind of asked separately for people who reported having children about their stressors in their personal lives. Homeschooling, only 28% said that was a stressor. These data were collected in June to September. So I think if you were to ask pediatricians now, probably that would be much higher. And so just another quote from the Places study. This pediatrician said, having to be a full-time physician, full-time mom, and full-time teacher during our surge was unbelievable. I felt pulled in all directions and didn't do anything well. And we all know that's not a good feeling. So zooming back to overall workplace stressors, the Mental Health America study also asked, what are your top 3 work-related stressors over the last 3 months? I want to go over this one in some more detail. So the first thing on the list, uncertainty about when things will settle down or return to normal. Again, these data were collected June to September. I think that probably also reflects kind of that anticipation of a fall surge that, we weren't sure if things were going to get much worse in the fall, and that turned out to be true. Burnout, the second one up there. That reflects obviously increased work demands, increased home demands, and then decrease in restorative activity. Of course, we're going to be feeling burnt out. Heavy workload. If you think about all the additional and new protocols and procedures that we've had to adopt, continuously learning and following new protocols regarding scheduling, rooming, testing, increased sanitation demands, screening patients, managing patient compliance with our new policies. That all has increased our workload during the pandemic. And then we see concern of getting sick and spreading COVID. I know in my clinic, we've had a lot more clinic staff out with COVID, and it's been pretty unsettling. And then down at the bottom, I kind of want to skip ahead to the down here, insufficient training, distress about how to effectively treat COVID patients, inappropriate role designation, working at a new location. Even though these are at the bottom, that just reflects we don't always feel like we know what we're doing. And that is very stressful. I know in my clinic, we've had a lot more floats or covering staff, who might not know where things are or just kind of our nuanced way of doing things. And there's a lot of stressors that come along with that. The Berksey study asked a similar question, top stressors of, again, these are non-physician healthcare workers during the pandemic, but this was more general. So they asked about, things kind of more in society, not just in work or personal lives. This was also done in October, so right before the election. So as in the other survey, we see fear of getting COVID-19, fear of spreading it. But then again, this kind of highlights the overlay of the other things that have been going on in our society during the pandemic. We see the general state of the world ranking in at number 3 stressor, and then also the election. And so, the public consciousness had really been focused largely on the COVID pandemic and the election. And then the killing of George Floyd really captured the public's attention and heightened awareness of the longstanding problems of racism and police brutality in our society. And after months of quarantine and social distancing, people came together and protests and outrage, as they have again following killings of Casey Goodson and Andre Hill. With the public discourse shifting to the impact of racism in our society, that also led to increased attention to the disproportionate impact of the COVID pandemic on communities of color. And so this is a screenshot from the COVID Racial Data Tracker website. And they advocate for, collect, publish, analyze racial data on the pandemic across the US. And it's a collaboration between the COVID Tracking Project and Boston University that began when Dr. Ibram X. Kendi wrote a series in the Atlantic about the urgent need to start gathering these data. And so ever since April, they have been publishing these data twice per week. And so this was updated as of Sunday. I'm sure they may have updated it again. It says that nationwide, Black people have died at 1.6 times the rate of white people from COVID-19. And so that's over 55,000 Black lives that have been lost due to COVID-19. And with these data, Black people were accounting for over 16% of COVID-19 deaths where race is known, whereas they make up about 13% of the US population. And Dr. Fauci has commented on this as well. He says, health disparities have always existed for the African American community, but here again, the crisis, how it's shining a bright light on how unacceptable that is. When you have a situation like the coronavirus, they are suffering disproportionately. When this is all over, and as we said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. So maybe you've heard some version of the stress bucket before. If you haven't, imagine you're carrying a bucket of water. The water is the stressors in your life. Maybe the typical stressors, or some typical ones might be your partner or spouse, kids, work, finances. And for a lot of people, their buckets run pretty full most of the time. So when you start adding chronic stressors, the rain that just keeps on falling to your already pretty full bucket, it's hard to imagine how your bucket wouldn't overflow or spill. And so, our buckets they're full right now, and it makes sense that they're starting to overflow in some ways. So this question from the Mental Health America study asks, in the past 3 months, which of the following feelings have you been experiencing regularly? Increased stress is what we can all agree on, over 90%. And that stress, I think, reflects the high demands that we've talked about already. And then anxiety, which I think reflects the uncertainty that we've talked about already. Frustration, that I think reflects interference with our other needs and goals. And then exhaustion, burnout, overwhelm. These emotions reflect being stretched too thin for too long. And then you can see all the way there at the bottom, they did actually ask about positive emotions, but these were sadly rarely endorsed. This is another kind of similar question asked by the same study. In the past 3 months, have you experienced an increase in any of the following? So kind of to summarize these, over 60% of the workforce endorsed having more trouble sleeping, feeling more physically and emotionally exhausted, and dreading going to work. So if this applies to your work setting, or generalizes, let's say you have 20 people who work in your clinic, 12 of them or more are feeling or having more trouble sleeping, they're feeling more physically and emotionally exhausted, and are dreading coming to work. The Berksey study also asked about the sleep issue. In that study, 68% reported getting less sleep than last year. 86% reported getting 7 hours of sleep or less. 30%, almost a third, reported getting 4 hours of sleep or less on average per night. And 1/3 reported they believe they are making more mistakes at work. And that obviously comes as no surprise. There's a big literature already existing about sleep deprivation and medical errors. So in general, these studies ask people to report on kind of the more outward or apparent impacts of stress, but we already know about how chronic stress impacts the body, and the studies couldn't capture all of this, but I think it's worth just quickly reviewing. I'm sure you know already a lot about this. So our muscles, when we're exposed to chronic stress, our muscles remain tense, which can lead to tension headaches and migraines. We experience chronically increased heart rate, blood pressure, stress hormones, increasing risk for hypertension, heart attack, and stroke. Our HPA axis is chronically activated, impairing communication with the immune system, and our immune systems weaken. Our brain-gut connection becomes impaired, causing pain, bloating, and other gut discomfort to be felt more easily. And chronic stress also negatively interferes with male and female reproductive systems, making it harder to conceive. So, are people coping effectively with all of these stressors? I think the short answer is no, or at least not everybody. The Mental Health America study asked, do you feel like you have adequate emotional support over on this pie chart? And 35% did say yes, but 39% said no, 26% not sure. And then they also asked, from whom do you receive emotional support? The common ones are up there: family, friends. 12% said no one. And I think, that just kind of drives home, like, not everybody's doing okay. Not everybody has somebody to turn to in these times of stress right now. And so with all that, you probably would expect an increase in mental and behavioral health disorders and substance use disorders. I'm not going to go into studies in detail, but just to say that, yes, the research does back that up. We are seeing an increase in anxiety, depression, child abuse, domestic violence, substance overdose during the pandemic. And then with an increase in all of those mental health, behavioral health needs, I think then it's obvious there's going to be a strain on the mental health system, the mental health services. Crisis lines are just one example of that. So The crisis text line came together with a few other organizations to create the Mental Health Fund. And that's where this is a screenshot of their website. During COVID-19, this is actually just from March, these organizations experienced a collective 40% increase in volume. I also like this heading that says the mental health impacts of COVID-19 will outlast the virus, just reminding us that things like depression, anxiety disorder, substance abuse, those things don't necessarily just go away when the virus goes away. These are things that we will need mental health services to help people. And so, maybe you're kind of thinking, yeah, this was 2020 though, now we're in 2021, the vaccine rollout, this is all just going to be over soon. We can just tough it out over the next few months. But the stressors do keep coming. And even with the vaccine rollout that comes with it, its own stressors, kind of like telehealth, like there were so many, that solves so many problems, but it does create new stressors too. So there's many reasons why it would be prudent to check in with yourself at this point in time and reflect on the changes that you could make to better manage stress in the coming months. And so Dr. Garbaz is going to be talking with us more about how to do that. And before I turn it over to Dr. Garbaz, I know I've just talked at you for like 30 minutes straight. Are there any questions or comments that I should answer right now? Okay. Well, with that, then I'm going to turn it over to Dr. Garbaz.
Okay, great. Thank you. Go ahead and get my screen up. Okay. So we're going to take a quick break from listening and give you a chance to engage a little bit. Oops. So we have a word cloud started here. If you should be able to see at the top here, if you haven't been able to type in those numbers yet to text this phrase, you can still do that. And you will get a couple messages back. Everything on this is private. Your information is not going anywhere. Your phone number is not going anywhere. But if you can just type in, you can type in as many words as you want. Thinking about this question, what thoughts have been on your mind as we head into this new year? And the bigger words that you see means the more people have put the same thing in. Okay, so I think this is pretty telling. All of those things Bethany talked about in the larger world that are impacting how we're feeling all the time, even when we're at work, when we're with our families. This uncertainty is first and foremost, and really has been throughout the pandemic, kind of like the rug being pulled out from under us, only we never know, what's coming either. It keeps happening. Looks like some panic. Family has been on people's minds, the political climate, friends, vaccinations coming, safety, travel, Okay. Thank you all so much for sharing. So there's a lot on everybody's mind, clearly. So I want to build on this metaphor that Dr. Walker already discussed with when we have physical demands placed on us. So if you're not familiar with Heartbreak Hill and the Boston Marathon, it's mile 20, and the Boston Marathon is considered one of the most challenging races or marathons. And Heartbreak Hill has its name partly because it comes at a point in the marathon at mile 20 where runners really tend to kind of hit a wall. And so they're already really tired from this long 20-mile race they've run so far and are getting ready to kind of push themselves that last 6 miles. But in the Boston Marathon, what happens at that point is seeing a hill ahead of them. And it's not that the hill is so big or so steep, just that the placement of it in the race. And, you know, Heartbreak Hill has been described by people as a stretch of the Boston Marathon where races have been won and lost. So it's a pretty critical point in the marathon where there's, you know, a lot that can happen. And I thought that was a pretty good metaphor for where we are. We have endured so much. We have worked so hard. We have a lot to be proud of ourselves for in what we've been able to do to keep society going and keep our families going over this last, you know, we're coming up on a year. And yet we know that we have a distance left to run, and we don't know exactly how long. We don't know how long our marathon is going to last. So, you know, in thinking about how do we cope with our own heartbreak hill that we're dealing with, you know, it's tough right now because we feel like the end is more in sight than ever in some ways as vaccinations roll out. Maybe we have this way to combat this virus, and, you know, we have sort of a light at the end of the tunnel for the first time in a long time. But we do know there are still a lot of hurdles to overcome. It's not going to be as easy as we wish it would be. So we know we have the big task ahead of us of vaccinating the public, and that's been in a lot of people's minds. I'm sure all of the challenges with that have been on people's minds as well, and we'll get into that a little bit more. It's a time where people, as this you know, hope for an end in sight is emerging, it's a time where people just desperately want to let go of those safety precautions. They want to be able to let their guards down. They want to be able to give their children some hope of, you know, when this will be over and when they can spend time with their friends again and when they can go back to school consistently again. But we just don't know any of that yet. And so with safety precautions continuing to remain in place, yet some people being vaccinated, that's a very tricky thing, because for a long time we knew we needed those safety precautions because we had nothing else. And now that we have something, why do things have to stay the way they have been? It's hard. It's, I think, easier for healthcare professionals to understand and public health professionals, but much more difficult for the general public to understand, and especially for children. We also know that there are persisting inequities in access to education that we're going to need to contend with, residual and persisting mental health issues that Dr. Walker began to discuss, racial and socioeconomic disparities that are going to continue and potentially widen further, and economic hardship that, again, will persist through this pandemic, but, you know, we may end up with a lot of things to clean up too as we move on. So we're going to dive into some of these, but first, you know, it can be overwhelming to think about any one of those things, much less all of what we're dealing with. And I think at this point, everybody is so tired and in some cases so numb that how do we keep facing these things? How do we do anything other than try to avoid thinking about them? I think a lot of people have sort of just tried to focus on one day at a time, one aspect of their life at a time, trying to get through their day at work, things like the things we can control, which is a really healthy way to manage stress. But we also do have to be planful, and we do have to keep a lot of these stressors in mind to be able to help our patients and our families as best we can. So how do we both hold on to all those overwhelming pieces without dismissing them so that we can address them, but also keep ourselves healthy enough to be able to do that? So stress management techniques are both helpful reminders for ourselves about small things that we can do to make this easier, but also things that we can, kind of remind the people that we work with. If we're in, patient focused and patient-centered roles, we have lots of opportunities to just pass little things along to help people, and these are great ways to help. So the biggest thing with stress management is to make sure that you're remaining open and you're making sure you accept what's going on. Again, that can feel very overwhelming, and so it's really tempting for people not to do that. I think we've seen a lot of that in this pandemic. People who haven't accepted that that COVID-19 is real, people that haven't accepted that safety precautions are necessary. That can often be an indicator that it's just too much. It's too overwhelming. So they would rather, to prevent themselves from feeling that stress, just not think about it. And in order to actually manage stress, we have to be open and understand and accept the challenges that are ahead of us. But when things become overwhelming, oftentimes what is so overwhelming is thinking about the past and thinking about the future. So, reviewing all that we've been through is overwhelming. Thinking about all that we have to do in the future is overwhelming. But if we can bring ourselves back to the present for these moments, these breaks, that can be incredibly powerful and rejuvenating. So I wanted to just engage in a short activity with everybody. This is a mindfulness activity. You can use this anytime. I chose it as something that you could use at any point in your day. So if you can just lower or close your eyes for a moment, just take a breath in and out. Try to relax your shoulders. Take your index finger of your right hand and slowly move it up and down on the outside of your fingers. There's no right or wrong way to do this. Just trace each of your fingers on the outside, up and down. Think about what it feels like, what your eyes are taking in. Any thoughts come in your mind, just notice them and let them go. Notice any sounds you might hear, anything you might smell, and just be in this moment. And go ahead and switch hands. Take your left hand and trace the outside of your right fingers. Really think about that sensation. Okay. And then put your hands back down, take a breath. And just notice how you feel. Some people that might have been really challenging. For others, it might have felt like a little bit of a break, some fresh air. That is the goal. And for those of us who have trouble slowing down and sort of being in the present moment, it can be kind of frustrating at first. It's hard to do that, but it's something that with practice, it's like building up a muscle. It just becomes easier. So whether you use that activity or something else, having some way to anchor yourself in the present and just take a quick break and a quick breath or two can really help you sort of recenter and feel refreshed to take on the challenges that you have ahead of you. Another way is remaining active or engaged in anything. This could be a productive way to do it, like taking a walk or cleaning the house, or, something you just enjoy doing physically for fun, playing with your kids, going for a run, anything that gets you up off the couch in your downtime and isn't a stressful activity is really helpful for staying anchored in the present. Practicing self-compassion is huge. As Dr. Walker said, there is not a lot that we've had to face in this pandemic that has been rewarding necessarily, or I think you're often either feeling like you're having to make very difficult decisions and neither decision feels good, or you are not doing things as well as maybe you felt like you could in the past because you're pulled in so many directions and you're just tired. So just being kind to yourself and remembering that you're doing the best you can, and that is okay. And in a pandemic, it is okay to not be functioning maybe the way that you did before the pandemic, and just doing the best you can. Seeking opportunities for gratitude is also been shown through research to be an incredibly powerful way to manage stress. This doesn't mean sugarcoating. This doesn't mean denying anything difficult that's going on or minimizing it, but it means oftentimes when we are faced with something negative or overwhelming, we tend to eclipse the good things. It overtakes. And so by, whether you write it down in a journal or you just kind of remind yourself of the things that you are grateful for and the positive things in your life, it helps those more difficult things just not overtake. And it helps to sort of anchor you. And then maintaining relationships and connection with other people is extremely important. And it, based on some of the data that Dr. Walker presented, that's been easier for some people than others. But I've been, since the beginning of the pandemic, just so impressed with how creative human beings have gotten with the resources they have to maintain connection with others. And I think there's been a lot of positive ways that this type of stress management has played out. But it's not that way for everybody. And so, can you just share a tip of a way that you connected with somebody recently with, a friend or a colleague that you're talking to? Just passing those little things on that have been positive in your life sometimes can make a huge impact for somebody else if they may be kind of weighed down with what's happening in their own life. So the next thing I wanted to touch on was all of the ways that education is going to need to be adapted. I'm not an expert in this area and I'm not going to go into depth, but I think it's, when we work with children and families, it's just so important to be thinking about that piece of their lives as well. So obviously we know that there's a larger gap in student skill level at this point. Teachers are finding that whereas they may have had different skill sets in their classroom, that has really, really widened during the pandemic, because not every child, when they haven't been in school, has had the same access to learning the curriculum or maybe having someone to teach that to them when they're at home. So those gaps are widening, which is a huge stressor for our teachers as well, to try to meet all of their students' needs. And then we know that there were already existing racial and ethnic disparities within our classrooms and in our school systems, and that is only widening, depending on the different level of support children have at home, or even access. Even internet capability has been an issue with access or having computers, things like that. And some schools are starting to report more failing grades and more dropout, but it's also been noted that the data is incredibly incomplete here. So I don't think we really know the full impact that COVID-19 has had on children's education for what will be, more over one academic year. We don't know what's going to happen moving into the fall, but we will have had, several months of school early in the pandemic that were largely canceled. There were some attempts, but largely canceled for a lot of children. And then, this year they've been in and out of school. So there just isn't as much information as I think there will be moving forward on the effects of that. There's no doubt that education will be changed post-COVID, like so many other things in our lives. some of those changes could end up being really positive. So, some people are advocating for continued access to distance learning. So much like telehealth will likely stick around. It'd be hard to roll that back at this point post-pandemic. Distance learning may stick around, and there were some disparity, for instance, in how advanced learners were able to access advanced courses. So like high schoolers, might have had difficulty accessing different advanced courses, and that disproportionately affected their ability to be ready for college or whatever they wanted to do after high school. But it may minimize those geographical barriers that were in the way if distance learning can become sort of an accepted and relied upon source for education in the future in specific areas. So in addition to education, we also are seeing the mental health care having to adapt. It's certainly feeling the weight of the needs during the pandemic, but there have been a lot of ways. There was a study, more of an opinion piece that was published in the Lancet Psychiatry Journal, talking about all of the different ways that, this was published in the fall, so all of the different ways up till that point that the pandemic has affected mental health and access to mental health. So we do know that there have been adverse effects on previously healthy people. So there are more people, as Dr. Walker talked about with the data she presented, who are endorsing maybe new mental health problems or just in need of therapy, whether they have, something that's reached a clinical diagnostic point or not. People just needing more support. And then we have those with pre-existing mental health conditions that have been adversely affected by difficulties with access to care during the pandemic, or just not being able to be seen in person as much. Telehealth is just not as effective for everybody, and that's made a difference. So some of the changes that they outlined in this article that have been needed to support mental health during and after COVID-19 are first and foremost the need for social support systems and emergency funds. Certainly this has been a topic of urgent legislation need in Congress a couple of times now. Our society and our country just does not have a strong support, a safety net. And so there's no way that we can talk about improving someone's mental health if their primary needs are not met. And people are still struggling to find those safety nets and those emergency funds, and they are uncertain, which we know, adds to mental health and stress. Some of these funds are temporary, and people wonder what's going to happen when they are no longer available, things like that. So that's one thing that's crucial. Another is how things proceed with telehealth laws. So for instance, right now, I can see someone in West Virginia through telehealth because there's a temporary emergency order that allows, my licensure to extend to West Virginia for a certain number of patient care hours. It keeps getting extended. It could get repealed at any time. There is there are like 15 or so states right now that have entered into something called SIPACT, which is a consortium of states who have said, hey, we want telehealth to be able to continue, and we want people in neighboring states who need to maintain access to their provider in a different state or that kind of thing. We want that to happen, and so we're going to allow for telehealth to occur between states in these kinds of situations without licensure being a barring issue. And but that's obviously quite the minority of states in the country who are engaging in that kind of a pact at this point. So that may be something that starts to gain some traction in the future. We don't know. And of course, insurance could stop covering telehealth services at any time. So that's also a big unknown. And there are some things that they have stopped covering. Home-based services have also been extremely important during the pandemic. There was a large disruption in that. for a while, which, really impacted people. I know in the pediatric setting I work in, we work with some really medically complex children who have, compromised immune systems, and for whom being exposed to COVID or any kind of respiratory illness could land them in the hospital and could be lethal for them. So, those children obviously are eligible for home-based services. So it's critical during, and the same on the other end of the spectrum with elderly folks. So those home-based services are critical that they continue. And then there's, for a long time, early in the pandemic, there were issues with making sure inpatient units who provided psychiatric care could manage infection control. They weren't necessarily medical units, and you didn't have the same kind of precautions and procedures in place as a medical hospital might, and that they had to get up to speed quickly on that. And so those can, that's something that could continue after the pandemic and really be something that could be beneficial, actually. So as far as, and then when we think about special populations that have needed extra support, that's been a major area in mental health that has needed to be addressed. So for instance, healthcare workers on the front line, I mean, I'm sure everybody has read accounts of just how difficult it was on the front lines, like in places like New York City, when hospitals were just inundated, and the trauma that the healthcare workers went through as it was difficult to care for everybody. So those populations are going to continue to need support as we move forward. As Dr. Walker said, this just doesn't go away when the pandemic goes away. And then of course we have, racial and ethnic disparities related to access to care. And then of course, increased burden and more likely to lose a loved one for some racial and ethnic minority groups. In fact, most. So, I would put those groups too under access for special populations and certain needs they're going to have, but they've already had reduced access to care historically. So that absolutely needs to be addressed in the future. So, these may be issues that you run into in your practices or with the families that you work with. And, it may be something that we continue to see for a while. Okay. Why are my slides not advancing? There we go. So I mentioned supporting healthcare workers. There was a study that it's from the journal Anesthesia, and it came out of Australia, which I thought was an interesting perspective from outside the US, looking at what has been necessary to help healthcare workers meet these extra demands during such uncertain times, because obviously healthcare workers have been in the forefront of this pandemic. And there were two areas that were most important. So one was self-care, and the other was, they called it organizational justice, but you can think about organizational support for employees. So as far as self-care, it is a lot of what we've already talked about, a lot of what Dr. Walker talked about, but the self-care items that were the most research-based as far as what helped the most were physical activity, good sleep hygiene, which has been implicated in medical error rates, interpersonal conflicts at work, and peak performance. So without good sleep hygiene, all of those important areas are negatively affected. Social support at work, and I would argue probably outside of work, altruism and finding meaning in work is important. And those mindfulness and stress management techniques we talked about. And on the organization side, what was incredibly important was a positive work environment. So that is what helped healthcare workers get through this, was having employers who treated them fairly, with respect, and had social justice in mind, so that there was some equity among what everybody was sort of required to do to pitch in. And that organizational support for a positive work environment involves work-life balance and professional connectedness. Those were important. And leadership was also incredibly important in this. So good communication from leadership, support for professional relationships within the work environment, and connectedness in the work environment when so much of that has fallen away outside of our work environments, clear expectations, and having sufficient resources. And unfortunately, there was so much in the news about, particularly at the beginning of the pandemic, what an impact it had on workers who did not have sufficient PPE resources. Okay, so another quick checkpoint here. What has been on your mind when you think about COVID vaccines? Okay, we're seeing some more positive emotions come up in this one. Hope, safety, equity is a big one, access, disparity, uncertainty, research, untested, distribution, education, some nervousness. The process has been slow. Yeah. So, we're seeing some conflicting emotions here. Some people who are nervous, some people who can't wait to get in line, some people who are recognizing that the process maybe, there's a lot to think about as far as equity and who gets it and when. So it's everybody's highlighting what a complex issue this is. Thank you so much for your responses. I think this is really reflecting the next several slides I have here. So vaccinations are here. When we put this talk together in December, that wasn't the case. We've done a lot of updating in the last not even month. So public sentiments about the vaccines have actually been shifting. There was a lot of nervousness before they rolled out. The data on the vaccine's efficacy does seem to be swaying the public. That's where a lot of the change has come from as soon as that data came out. There was a Pew Research poll that was done in September, and it found that public sentiment is shifting more toward more people being open to the vaccine and considering getting it. The two groups that were the most skeptical, according to this poll, were women and Black people in our country. Although it was noted that the rates of openness in Blacks are slowly increasing, and there was also a political divide, with Republicans being more skeptical than Democrats. So a number of things really, were thought to influence these data. So, number one, we have to recognize the injustices in the medical world that have happened for Black people in our country. The Tuskegee trial being the most well-known. And we'll go into more about how we can help support people who are understandably skeptical of this. And then, I was thinking they didn't give a lot of ideas about why women were more skeptical. I had thoughts about, women who maybe were trying to conceive or pregnant and concerned about vaccine safety, but that's just conjecture. And I think, it's been so challenging with, particularly before the election, the vaccine being so politicized and people feeling nervous because of that. We also already had some sort of anti-vaccination type propaganda happening in our country before this that we know we have to contend with. But another thing that seems to be swaying people a little bit is the scarcity principle. And you may have seen this play out in your, where you work, or depending on how available the vaccine is. The scarcity principle says that if something is not as available, people are going to be more interested in getting it. So someone that might have been on the fence, all of a sudden, if they think they might only have access to it for a short period of time, might be more willing or more interested in receiving that. So that certainly, I think, applies with the way that the vaccine's being rolled out right now, and not knowing, okay, once this vaccine hits my workplace or my hospital, should I get it now because I don't know if they're going to get another shipment. So I've put together here some information from the health behavior literature on talking to people about getting vaccines. And this is a vast literature. It's tricky because, this is going to be similar in a lot of ways to how do we talk to people about the way, how do we talk to people about getting their flu shot? How do we talk to parents about vaccinating their children? A lot of that is going to draw on the same, types of principles involved there. But then we also have this politicized nature of the pandemic and potentially the vaccine. I think we saw from that Pew Research poll with Republicans being less interested in getting the vaccine than Democrats. So there's also that overlay. So the question is how to get to herd immunity, which is obviously the goal of the vaccine, without a mandate. And it's just under it's provisional right now. It's under emergency use. So I don't think there's talk about mandating the vaccine right now, but that could be something in the future that is talked about. So we know that health decisions are driven by perception and beliefs. That's the most important thing to keep in mind when you're talking to somebody. Health decisions are not purely based on education or lack of education. So providing somebody with more education can be helpful, especially if they're on the fence about it and they just want to, get more data that it's safe. But if they have certain perceptions and beliefs about it that isn't really based in safety, but other things, your education for them that it is safe is not necessarily going to persuade them. And I think that's a lot of times where the frustration comes in for physicians or nurses who are talking to families who are not really open to vaccination. So one of the best ways to start working through this is to create an appeal through Socratic questioning. Another sort of type of terminology for these kinds of questions is called motivational interviewing. If you've heard of that or been trained in that, it's the same idea. So just talking to the patient about what their perceptions are. What do you think may happen if you get COVID? You might actually be able to find areas that they may be lacking in information, and maybe that is driving their perceptions and their beliefs. What might happen to those that you know if they get COVID? How might you benefit from the vaccine? What could be different if you get it? Which is tricky right now when safety precautions are not necessarily going away. But maybe that could be more of a conversation in the future. How might my friends and loved ones benefit if I get the vaccine? How might the public benefit if I get the vaccine? All of these questions will not speak to all people, but you may hit on something that can give you more information and help you know how to steer the conversation in a helpful way for that person. Another really key thing to having these conversations about the vaccine is listening to people. So again, if you're just throwing information at somebody, their concerns are not going to feel heard. Their perceptions are not going to feel heard. They're not going to feel heard about that. So giving them a chance to tell you what they think is really helpful. And there's also a theory called moral foundations theory, which talks about responding in a way that really affirms a person's moral value. So some people may feel swayed to take the vaccine if they feel like they're going to be helping somebody else. If this could help society, maybe they could kind of get over their nervousness about it and do it. Whereas somebody that's not really something that's going to sway them, that's not a big part of their moral code or one of their moral values, and they're a little bit more individualistic, you might need to appeal to that part of things. And, oh, this is really going to help you be able to go out and do those things that you miss doing eventually. And then empathizing with mistrust about the vaccine is critical. There are people who are going to be mistrustful because of a history of treatment, whether they're Native American, whether they're Black or African American, whether they're Latinx. There are ways in which mistreatment in the past has been passed down generation to generation, and it doesn't, those warnings don't go away lightly. And having those open conversations with people and recognizing why they're concerned about it, not trying to minimize it, but also helping them see maybe specific data that could help them feel a little bit more comfortable. And then, of course, we've talked about the politicization of the vaccine too, and that's just going to be a huge part of this. But at least if you listen, you can understand where someone's coming from. And that can be tough when they're coming from a very, very different place than you are. So I wanted to throw the stages of change up there. This mostly comes out of the substance abuse literature and trying to prevent relapse, but it's been applied in a number of different ways. So when you're talking about how to talk to someone about vaccination, it's planting seeds. It's not that unless they're really on the fence, it's not going to be in that visit that you're probably going to have them say, oh yeah, I just needed that extra piece of information and I'm on board. It's going to be more of a, every time they come in, I might just keep planting some seeds. This is, oftentimes how therapy works. So somebody might come in the pre-contemplation stage, that top circle, and that's really, I'm not interested in this vaccine at all. And, I'm not really going to listen to a lot of what you're going to have to say. And that might be the stage where you need to do a lot more listening and understanding where they are. And then you might be able to move them through some of those questions we talked about into that contemplation stage. And preparation and action would be the ultimate goal of having them, feeling ready to take a vaccine. So, moving forward, I think it's important to keep in mind, not everybody has the same goals. Societally, public health officials have said the goal would be herd immunity so that we can start to rely less on these safety precautions and move into a world where, that's not dominating our lives anymore. But we're in really early stages of this. So right now, not even everybody has access to the vaccine, and we have to be really careful to support each other in where we are. There may be people waiting for these larger studies that are happening with the vaccines, but just making sure that we're respectful of each other, our colleagues, our family members, our patients and families in these early stages, because everybody's been through a lot to get here, and everybody is processing things at different times and has different priorities and maybe underlying health conditions and things like that are going to affect whether they can get a vaccine or whether they want to get a vaccine. So we're not going to make anything better by trying to push an agenda on somebody else. There's also going to be a little bit of challenging things to navigate, as some people are vaccinated and some people aren't. And I think healthcare workers are going to feel that, especially since we are, being vaccinated earlier than the rest of the population. Obviously, we know we're going to be managing these long-term health and economic effects we discussed. And vaccine access for everybody is still unknown. So we do still have those challenges ahead. So I want to end on a note of resilience, because this is what has allowed us to get to where we are at this point. And this is what's going to allow us to be able to face all of those challenges ahead. There's a large literature on resilience. And so I'm just going to briefly touch on that today. Resilience is defined by the American Psychological Association as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. I think we can all agree that we've either experienced some of these things, or certainly many people in our society have. Resilience is not something you're necessarily born with. It's not something that you just wake up and have one day. It's something that's learned, and it's something that's practiced. So we really need to sort of make that choice over and over and over again to finally feel like we've been resilient. So when Bethany was talking about that hill, you know, if you keep stopping and you keep saying, I can't do it, and you're sitting down and you're giving up, you are not making the choices that are going to allow you to work toward resilience. But if you push yourself, you may need to sit down sometimes. Self-care is okay. That's part of resilience. But then you step back up and you keep doing it. That's when you have something to feel proud of and you feel like you've met those challenges. That's resilience. So what's incredibly important in resilience is, and allows you to be resilient, is being open to help. Somebody who just tries to do it all on their own is probably going to have a very hard time being resilient. So, you know, you encounter those people in your practices, I would be concerned about that. And that's maybe something to chip away at with them. How can they be more open to letting someone in? You might think about that for yourself too. Practicing those active stress management techniques we talked about, and building up protective factors. Protective factors are things that help when you're in those moments of stress. How do I move on without it feeling like it has traumatized me, without feeling like it has really broken me? So if you just take a second to think back to some of the challenges you have faced, if you feel like you got to the other side of some of those challenges, just think for a second about what those protective factors were that helped you. Was it someone else that helped you? Was it talking about it? Was it, you know, breaking it down and making it more manageable, making lists when something felt overwhelming? It could be something as simple as that. But what got you through?
Dr. Garbaz, we have about 10 minutes left. So whenever you want to wrap up, we can take some questions too.
Thank you.
Yeah.
Okay, so whatever you thought about there, those are the protective factors. Those are what helped you be resilient, and you can draw on that. And that's something we want to think about with our patients and families too. What can we find in this patient and this family that is protective? What can we find that has helped them be resilient before, that they can harness and use to, you know, to get over that heartbreak hill? Sorry, sometimes the computer's not responding to moving forward. So another aspect of resilience is building community resilience. This is going to be so important for our country as we move forward. These are the aspects of community resilience that help that to happen. Togetherness, a shared purpose. You can think about probably more times that has broken down than not. But I have seen so many examples of how communities or workplaces have come together with a shared purpose, and that makes a big difference. Also listening to each other, letting people talk, hearing what they have to say. I've heard so much more, how are you doing? How are you getting by during this pandemic than I used to. People pitching in, doing what they can, having empathy for what someone else is going through, your coworker, your neighbor, and reflecting on what we have accomplished. There might be a lot more to do, and it might, in a lot of instances, feel like it's never enough. But if we can reflect on what we have accomplished, that can really help us keep going and help us realize we've been resilient. Post-traumatic growth is another area of the resilience literature. that's been highly studied. And I cited here an article that it's really the only one I know. It's a review article that really applied this to children and adolescents. So there's a large literature in adults, and it largely focuses on individuals who have faced a life-threatening illness like cancer, natural disasters. There was a lot of study around 9/11 and racial trauma. And this article systematically reviewed what was available just in the child literature. And this is an older article. I don't think this has really been replicated that I could find. So post-traumatic growth relates to positive change that was experienced as a result of the struggle with trauma. So it's what happens after a trauma, after someone has been able to be resilient, the growth that happens in that person. And so, we all have the potential to grow from this pandemic and these challenges that we're facing right now. We may not be the same people as we emerge. The different associations with post-traumatic growth were the more religiosity or spirituality people had, the greater their post-traumatic growth, the more social support they had, the more active they could be in coping styles. That was more effective than avoidant coping styles. But both of these coping styles were more effective than passive. So going out and doing something when you noticed that there was a challenge, or going out and engaging in something active, even if that was just going for a run, or making voter calls when the election was going on, things like that are active coping. Avoidant is, I'm going to go do something else because I don't want to think about this. Passive is, I'm going to sit on the couch and zone out and watch TV. So you want to go for active coping strategies as much as you can. And then mental health resources, having hope, optimism, positive affect, self-esteem, and confident beliefs are all areas that really help to make it more likely that you're going to experience some post-traumatic growth. And a negative association with post-traumatic growth was pessimism. There was less when pessimism was deeply rooted. So this is my last slide on resilience, and then we'll wrap up. Thinking about building children's resilience, there are a number of protective factors that we can build up in children that help to make them more resilient. So sensitive and responsive parenting is probably the most important. So building up parents is what's going to build up kids. Meeting their basic needs, of course, emotional support, caregiver support, enjoyable family activities, and maintaining social connectedness is all what is going to help our children survive this and thrive. There is a campaign, if you haven't heard of it, called On Our Sleeves through Nationwide Children's Hospital. The idea being children don't necessarily tell you what they're thinking or how they're hurting. They don't wear it on their sleeves. But if we start to ask and we give them the resources they need, we can join them in that and help them to open up a little bit more. So I just put that resource here as well. And this is one example of an article on their website, the pediatrician's role in health and hope after trauma. It's not necessarily COVID related, but it's applicable. So I have some slides here just for local and Franklin County, some mental health resources for children and for adults. And I am happy to take any question. Oh, and sorry, I almost forgot. We were going to do one more word cloud on, as Dr. Fauci said, this pandemic will end at some point. So one more word cloud on what you are looking forward to post-pandemic. I'm going to end on a little bit of a more positive note.
And if you all want to ask any questions in the chat box as you're doing this, that would be great. And then we will get ready to wrap up shortly.
I love seeing all of these. Family has been big. We've been worried about family, but we also are looking forward to spending more time with family post-pandemic. These are great. I know I'm looking forward to all of these things too. concerts, restaurants, hugs. These are great. Okay, so just a reminder, of course, there was a lot that went into the Roaring 20s, but it did emerge after the last pandemic. So we may have a lot of fun coming our way in the future. If we can just, imagine whenever that will be, we'll get there. So thank you all so much for your attention. And as Alex said, Dr. Walker and I are happy to answer any questions you might have.
Great. Thank you so much, Dr. Walker and Dr. Garbaz. I just have a few closing remarks, and I'm going to share my screen with you all. Great. Well, we just want to, with Ohio AAP, want to thank ODH for their support with the Parenting at Mealtime and Playtime program. And we want to thank Dr. Walker and Dr. Garbaz for their time to present. Like I shared before, our next training will be next Thursday with Dr. Nicole Baldwin on how to use social media to engage families. Please join us for that if you're available. Just to go over a few of the PMP resources that we have handouts from birth to 6 years old. And then we also have specific resources on play, hunger cues, picky eating. We're going to have a new handout on complementary feeding and a new handout on playing inside during COVID and cold weather. And we also have some new trainings that are also coming. So we're excited to share those with you all as well. And these handouts are also able to be accessed on the mobile app that you can download on Google Play or the App Store. And then to receive your MOC credit or certificate, please fill out this survey, and that is how you will receive it. And I will also send a follow-up email with the slides to this presentation, a recording, as well as this survey. If you have any questions, my name is Alex Miller, and I'm the program manager for PMP with the Ohio AAP. Again, thank you to ODH and Dr. Walker and Dr. Garbaz for presenting with us. And you can also access our social media accounts listed there on the slide deck. And any questions, please feel free to send me an email. Thank you, everyone. And we hope you have a great rest of your week. And we hope you join us for some more trainings.
Thank you for having us.
Yeah, thank you all.
Thank you. Have a great day.
And if there are any questions that come up, you can send them to me and I will forward them on to Dr. Garbaz and Dr. Walker.